it is. And so we absolutely recommend that children, even children who have had disease before, get vaccinated.
Next question, please.
Let's go to Monica Alba at NBC News.
Thank you so much. My question is the CDC closer to reevaluating the definition of fully vaccinated as it relates to third doses or boosters now that all 3 vaccines are approved for that? How will that be determined and when? And how might that figure into federal vaccination guidelines? And in particular, the U.S. Department of Labor mandate rule that we're expecting soon. Thank you.
Yes. Thank you for that question, Monica. The definition of fully vaccinated is 1 dose of the Johnson & Johnson vaccine and 2 doses of the either Pfizer vaccine or the Moderna vaccine. And we're not examining changing that definition anytime at this point.
And then I would add that the federal requirements will follow the CDC guidance. Next question, please.
Let's go to the Ebony McMorris at the American Urban Radio Network.
Hi, thanks for taking my question. This is to anyone. My question is, given the reduction in dosage for the Pfizer vaccine among 5 to 11-year-olds and the increased risk of the myocarditis in the adolescent population, is there any type of consideration in getting Pfizer to revisit the dosage for vaccine among children that are 12 to 18?
Dr. Walensky?
Yeah, may I take this? So thank you, Ebony, for that question. We carefully looked at this issue of myocarditis for our 5 to 11-year-olds because of exactly the question. And that is among the reasons that the dose was changed to a lower dose, 1/3 of the dose. And I do want to highlight that in the clinical trials that Dr. Fauci noted, there were no cases of myocarditis in the children between the ages of 5 to 11. The CDC has previously, as has the FDA, thoroughly reviewed the data and the evidence in our older age groups as well as our adolescents and have demonstrated that there's absolute benefit to vaccination over the risk of COVID and especially the risk of COVID-induced myocarditis.
Next question, please.
Grove at Bloomberg.
Hi there, thank you. Jeff, the parents today are having trouble scheduling their appointments. Can you say when vaccines.gov will offer scheduling for the 5 to 11 age group? I know you said that this will ramp up into next week. When can people log on and get that? And can you tell us also when you expect the OSHA rule to be released? Is that coming this week as well? And will it have an implementation period or will it just sort of kick in immediately? Thank you.
So on the OSHA rule, that will be coming quite soon. So in a matter of days at this point. And I'll leave the details to the rule when it's made public by the Federal Register. After 18 months of a pandemic, as we've all talked about, it's understandable that parents have anxiously awaited this day. It's a very important day, and we share parents' relief and enthusiasm to get their kids vaccinated. As to scheduling, some pediatricians and some family doctors are already beginning to schedule appointments. Many more will come across the coming days. By the end of this week, parents and guardians will be able to go to vaccines.gov to find locations offering vaccinations for kids ages 5 through 11 near them. CVS and Walgreens are already online, with more pharmacies coming online soon, so parents can schedule appointments for their kids over the coming weeks and days. And starting the week of November 8th, next week, 20,000 sites, convenient and trusted sites, will be open, and the kids' vaccination program will be fully up and running. Last question, please.
Last question. Let's go to Christina Hall at the Detroit Free Press.
Thank you for taking my question. It also had to do with the vaccines.gov website. We did not see a specific search option for the Pfizer vaccines for children ages 5 to 11. The only listing was for 12 and older. And with all of the advanced preparation, do you have a specific day this week when parents will be able to search for vaccines for children ages 5 to 11 on the website? And why wasn't the federal government prepared to have this search option on the website already, especially with the vaccines starting to be shipped out last week?
So it'll be on, as I said, by the end of the week, Friday. You need to get the vaccines to the sites. The sites have to be ready and up and running. And that's happening as we speak. More and more sites are coming online. We'll have a threshold number of sites online by Friday, and that's when vaccines.gov will be live. And vaccines.gov will continue to add more and more locations, those 20,000 locations and more across the coming days. Thank you for today's briefing, and we look forward to the next one.